It seems on a national basis, one part of medicine is getting a little bit like it should be, regionalized. Every hospital one time was going to have everything, and now they're starting to say, let's get a team centralized. Let's take an area, say Long Island, you take one hospital, you take all the pediatric cardiovascular surgeons, you put them in one place working together, and now you take more good people, centralized. It becomes less expensive, the team develops better skills, and that's probably the best approach we know in cardiovascular surgery in children, and I think that approach might fit well for even other areas. Does that make sense?
There's no question, particularly in pediatric cardiology, regionalization is very important. Congenital heart disease is fairly uncommon, and you need to train professionals to be able to handle this. And I think instead of smaller hospitals all competing with one another and working against each other, coming together to pool the resources, doctors, surgeons, nurses, facilities, all working together to provide optimal care and being trained specifically in these areas will allow them to take care of patients much more efficiently and have much better outcomes.
So I come from the Boston area originally, and Boston Children's, one of its forte was they sort of like regionalized pediatrics in many ways, and Tufts has their program, but they're friendly, and they sort of like, it made sense. Centralize it, and the doctors go to the other institutions, but they conference and they get together. It's the benefit of all children to have a regional approach to, I think, pediatrics. Is that true?
There's no question, and in today's day and age with technology, we're able to send, have conferences in many different locations through the internet and through teleconferencing, send echocardiograms over the internet and studies. So you're able to be in a region, in your own office, in your own smaller institution, conferencing with other doctors, and I think that will help. I think people are fearful of needing to travel or leaving where they are, but you can stay in that area and still work together to discuss the patients and create a situation where you're pooling together the knowledge and experience of many people in a given area.
So I can envision that if your kid had a rash and I wasn't sure what it is, I could probably take a picture of it, send it to a dermatologist. He could look at it and say, this is what it is, so you approach it. And by talking to me with the patient, he's doing two things. He's saving the patient exposure to an office that could be a lot of sick people, and also he's educating the doctor that wasn't comfortable with the rash. It enhances the knowledge of the doctor. It also keeps the patient from wasting a lot of time in multiple areas, and that probably is going to be the model for a lot of things down the road. Like you could look at an echo or EKG of some well-meaning adult cardiologist who's the only one in the region, say in a small area in, say, Iowa or northern Michigan, maybe nobody. You probably could work that out down the road, that everybody's working, I hope, for the benefit of all kids. So what's the big deal? I'm sure you get calls. My kid has a problem. Used to be training here. I knew you. And they ask you questions on the phone. And I think the next level of good care is going to be, we work through internet or other models to get the care centralized no matter where it is. Is that correct?
No question. I think the field of medicine uses technology in terms of bettering its equipment. However, I don't think that hospitals and physicians are as good as other areas of life in terms of using the technology for communication. You're absolutely right. Still, there's doctors who, there's a sick patient in a hospital, it takes hours to see the patient if they're in an area where there isn't a doctor close by. Finally, we're just starting to see tests being done at a community hospital, and this information being disseminated to physicians with expertise to look at it. And all that is going to do is provide quicker and more accurate diagnosis and earlier recognition of a problem and transferring to an institution that can better care for that patient.
So I find in pediatrics, I can't speak for adult medicine, we don't like really compete. We really sort of like, if I have a problem, I can pick up and speak to probably any pediatric surgeon, discuss it. I've called people outside of New York if we had an odd case, and at Boston or Philadelphia. And I don't get no's, and everybody gets involved. And if we just reach out, that approach might be the right approach for medicine. Take the walls away, the barriers away, because I think most people go in pediatrics only care if the kid does well. And sometimes the payment is to thank you in the eyes. Is that true?
There's no question. Most people go into pediatrics because they love children and also the camaraderie that you have with one another. As a pediatrician myself, I hope that we're certainly a specialty in medicine where our primary goal is to provide optimal care for the patient and to put things such as competing hospitals aside when it comes to the care of a child.
Because I have this vision that maybe we should regionalize most, especially pediatrics, and the only competition should be some kind of like an audit that says they have lower infection rate or they have a better result doing this, so they should get incentives financially for doing a better job, encouraging better care, and decentives and not get paid as much if they don't do such a good job based on they didn't do their job correctly. And maybe that'll help healthcare, because I think right now we have competition between institutions. New York, I don't know how many, 30, 40 hospitals in the area, it seems they're all in competition. I don't understand that. The only competition should be for good care, not who makes more money, who sees more patients. Its end point is just doing good care. Does that make sense?
I couldn't agree with you more. It's one of the unfortunate things about New York City compared to other cities. We have wonderful physicians and wonderful hospitals, but too much competition for, as you said, for these patients within that. And I think as people start to work closer together and as people realize the need to regionalize, I can only see this benefiting everybody in the society.
Because New York probably, in terms of pediatric subspecialists, probably have more than anybody in the world. But everything has come out as little institutions, so we don't have the Boston or the Philadelphia children, because everybody wants to be the #1 pediatric center, and we got divided. So I, and you, and a lot of people participated, the concept is a pediatric office without walls. I don't find a doctor says anything bad about another doctor. All they care about is if a kid is sick, we'll find. If you had a problematic case, you're not going to just sit there. You're going to be on the phone speaking to somebody, either where you're at or someone you respect in another institution, and you don't think, oh, I'm going to help this guy or that guy. All you care is to help the child. Is that the concept that most pediatric subspecialists think about?
In this practice, no question. In fact, that was one of the things that attracted me to this. We are affiliated with privileges at 7 hospitals, and we have offices in 2 states, and we send patients to multiple institutions. We look at each case individually and send that patient to that institution that meets their needs, whether it's location for them, meeting their insurance needs, and providing the best care for that particular problem, and not being pigeonholed at all as to where you need to send a patient.
I mean, I've sent patients to Philadelphia, Boston, once to San Diego, went up to Montreal. I sent a kid to there's a hospital in Toronto, I think the largest pediatric hospital. They had to be a unique doctor for a unique situation. And I think patients don't lose respect, you gain respect. You found the right person for the right job. But New York, it's just fragmented. I hope with some of these things we're doing, we can unfragment it and say, just take a little float. There are really good guys around New York. And unfortunately, there's a little division between institutions based, I think, more on ego than common sense. Is that true?
That is true. I hope that we're turning in that direction. At least in my career, in the last 10 years, several larger institutions have come together in New York City and in Long Island, have come together to at least start to bring the resources together to improve that. It's still somewhat fragmented, as you say, no question, but at least I think we're starting to see the beginnings of these major competitive institutions merging at least and coming together.
Well, Long Island seems that Schneider became the center point, and in Brooklyn, my institution, Maimonides, is sort of like the main pediatric center. A little bit of downstate, and there's a little bit of Brooklyn Hospital and whatnot, but it's still not glued together the right way. I would love to see no walls, everybody work as one. I hope somewhere along the way that my dream is that pediatrics is just one big, happy, continuous, no fence type situation. And I hope that happens down the road.
I hope so too. That would be great for all involved.